So we're going to divide, like I said before, the trigger points of the lower limb into a couple different sessions. There's really not that many slides for this week. So we're going to start, obviously, in the hip and then work our way down to the thigh and then, lower leg and then ankle and foot. That's the plan. Gluteus maximus. So some causes for trigger points in the glutes would be uphill walking, vigorous contraction in a shortened position, vigorous eccentric contraction when preventing a fall. Do you guys remember what eccentric and concentric are?
Yes.
We will refresh your memory. So I'm going to use the biceps because that's the easiest. Concentric would be the shortening, yes, the contracting. Eccentric would be elongating, so as I'm dropping the arm back down to a straight position, that bicep is now doing an eccentric contraction.
And the triceps are going up.
Yep, so that the antagonist switches with that. All right, direct blow to the buttocks. Smack that. Don't. Elbow. Sleeping on one side with your hip flexed. Swimming, front crawl. What the heck does that mean? Front, like doggy style, right? Maybe. Is that what that is? Doggy paddle? Not style. Gosh. Send me home. Doggy paddle.
You're recording.
I am totally recording. Oh, man. Foot in mouth. Anyhow, where am I at? Sitting too long in one position, repetitious tasks involving leaning over. Cool. Symptoms or indications of trigger point: an uncomfortable and restless booty when seated. So this is the real pain in the butt. Pain patterns: posterior buttocks or the posterior surface of your sacrum. This is why, it's important to learn glute massage. So we're probably going to focus on that again soon because you all are scared of the glutes. And it's really important for low back pain. Y'all.
Who's y'all?
Y'all.
I do glutes.
Listen, I look at the surveys and people are like, did not address my piriformis pain. So we're going to teach you guys how to do that again.
Yeah, everybody writes that on here, I'm sure.
What?
I'm sure.
Actually, no, I've seen it quite a few times. So that's why I'm like, let's work on the booty. Some more of the glute max associated trigger points would be posterior portion of the glute medius, because there's medius, maximus, minimus. Or sometimes your hamstrings, because the hamstrings connect right up there, right? On the ischial tuberosity. Fun, another pain in the butt. So this is why a lot of times when people have low back pain, we are also hitting the hamstrings, the posterior leg. They don't understand, so we have to school them and let them know why we need to work on their legs to help with their back pain. Some people still are like, nah, I don't want my lower legs or my legs done. Okay, well, this will help you, but it's all right. Differential diagnoses would be from the glute medius and minimus, topographical location in the buttocks, distribution of pain, and depth of the TP tenderness. So trigger point tenderness. Or fibrosis of superficial lumbosacral fascia. So you can do myofascial release. Is actually really good for the hips and the sacrum because it's less invasive, I guess you can say, feeling. Glute medius. So this is that main muscle. This guy is actually a big problem muscle for low back pain. I call it the top of the heart. It just kind of hangs out right along the iliac crest. Possible causes for trigger points would be sudden falls, sports injuries, running. See, running's bad for you. Or long tennis matches. Make sure if you do tennis matches, they're short, guys. Pickleball. I need to rewrite this because I need to come up with better responses. Symptoms or indications would be pain when you're walking, obviously, difficulty sleeping on that side, or discomfort when sitting. It says in a slump position or just in general, right? Pain patterns. You're going to feel this all posteriorly. So posterior lateral booty, posterior surface of the sacrum, and the iliac crest, the posterior side. You can also have trigger points in the piriformis, pretty common. Posterior aspect of the gluteus minimus and the maximus. Cool. Other diagnoses might be trigger points in the glute max or SI joint dysfunction, pain in the lumbar facet joints of the lumbar vertebrae, or the low back pain.
So when you're going in, how do you know it's not the maximus versus the medius truly? Like,
Well, the maximus is sitting over it.
So, right, that's what I mean. Like, so it's so deep. How do you know you're actually?
Most of it actually is glute med if you're that high up.
Okay.
But
Is Max gonna be more in that meaty or
yeah, max is going to be more of the butt cheek. You know what I mean?
And medius
'Cause it's
is
such a
more
large-
around the crest?
Yes.
And then piriformis is just more like deep laterally or
So you're going to feel it.
strap like across between the.
Yes, you're going to
between the-
feel it here to the greater trochanter, and it actually hooks underneath the sacrum.
Okay.
So it goes
So you're
underneath.
not actually feeling the piriformis. You're just actually.
You kind of can if you're going deep enough, and you get the leg into a rotation. So
internally rotated or externally?
externally rotated, it's softening all those, and you can kind of feel that a little bit better.
Okay.
Half frog, like
Frog, yeah.
My hip hurt when I moved my leg.
My table. How did you go in?
Hydraulic tables,
All of us can't afford that yet, Bridget.
$2,000 tables.
Can't leave our table up all the time.
I actually, before I got the hydraulic table, work with my table lower because I have that Thai training. So I would oftentimes, not so much anymore because I'm getting chunky and old, but I would get on the table a lot, either fully or halvesies. So work lower, huh? It's fun, isn't it?
Yeah, you did. So it's
So here's that picture of different trigger points for the gluteus medius and where they might feel that pain. So sacrum. Minimus. This is going to be underneath the glutes, the glute max, obviously.
Well, that looks like the muscle I need to build up.
Right?
Well, I got a dip in my hip and I need
A
to
dip
fill
in
it
the
out a
hip.
little bit.
When I dip, you dip, we dip.
Yeah, that dip.
Gluteus minimus. This little guy can be caused, these trigger points words can be caused from SI joint dysfunction, nerve root irritation. A lot of it is probably coming from the lumbar spine, all right? Or prolonged immobility. Indications: hip pain that may cause a limp, pain when lying on that side, difficulty raising from a chair and standing up straight. See how it shoots down the leg? Good times. Pain patterns: posterior buttock, lateral posterior thigh and leg. Other trigger points: glute medius, piriformis, and then now we have vastus lateralis thrown in there. Do you guys remember if that's quads or hamstrings?
That's quads.
Clap, clap, clap. All right. Differential diagnosis. They might just have trochanteric bursitis, so the trochanter on the top of the femur might have bursitis in that bursa sac. pain from articular dysfunction, joint pain, or sciatica. One last one for today. The tensor fascia lata, TFL, also known as the little muscle whose tendon is your IT band. Causes landing on the feet from a high jump. Do not jump off buildings, guys. We are not Batman. Walking or running on sloped surfaces, immobilization in a shortened position for long periods. Think somebody who sits a lot, all right? Symptoms might be referred pain in the actual hip joints, pain tolerance for prolonged sitting, poor tolerance, I can't read, or inability to lie on the side with the trigger point or the affected side. Pain patterns, lateral, thigh, and hip. Literally just the IT band region is feeling it. Straight down. You can also have trigger points in the glute min. The rectus femoris. Do you guys remember where the rectus femoris is? Quads. Iliopsoas and the sartorius. Also, for the midterm, a lot of you did leg. So I just want to point that out, that a lot of you did leg. Cool, right? All right, other diagnoses would be glute medius and minimus trigger points. Neuropathy in the L4 region, and trochanteric bursitis again. Questions about some of those thigh and glutes? No? All right, we'll keep going on. We'll continue next week for that. Nice.